Hey guys, welcome to another episode of How to Self-Treat the Body, and today we are talking about the good old pelvic floor. Now I know this is kind of a sensitive area and it's kind of taboo to talk about it, but it has to be talked about because that area is full of muscle and fascia, and if those tissues are unhealthy and tight, it's going to affect um, the way you go to the bathroom, the ability to give birth, menstrual times, can be very painful. So we need to understand that this is a big area to pay attention to, especially as we get older, especially after you've had children, to really help limit the need for the wonderful adult diapers and or the urgency to just have to go to the bathroom right away. So before I show you, I have two exercises for you, but I kind of want to explain how the pelvic floor works. So you have your diaphragm, which is like right around the bottom of your rib cage, and you have your pelvic floor. So your pelvic floor works together with your diaphragm. Think of it as a second diaphragm. So as we inhale, the diaphragm lowers to give space for your lungs to expand. At the same time, the pelvic floor is supposed to lower to give space for the organs to move down in order for the lungs to expand, right? So as we inhale, the diaphragm and pelvic floor move down. As we exhale, they both move up. So they're supposed to work in conjunction with each other. And sometimes that rhythm can get out of place through going surgery, a trauma, birth. It can all kind of get jumbled up. So the first exercise we're going to help get that rhythm back in motion, which will also learn how you can how to feel the pelvic floor. We need it strong, but we need it strong but not tight, and loose but not weak. So this is going to help you kind of just keep it pliable um, and healthy. So hop on your mat, on your back, knees bent, feet on the floor. All right, so remember, as we inhale, our diaphragm is going to go down, our pelvic floor is going to go down. As we exhale, they're both going to come up. So without moving anything, as you inhale, kind of allow the area that you go to the bathroom with, just really allow that to soften and feel that kind of expand like a balloon down there. Now as you exhale, allow that balloon, like you're sucking the air out of the balloon, allow that to lift back up into your vaginal canal, basically. Inhale, allow it to balloon out. Exhale, let it come back in. Again, inhale, allowing it to balloon out. Exhale, allow it to kind of scoop back up into your pelvis. Now we're going to start to bring in pelvic tilts. So as we inhale, we're going to take our hip points towards our thigh bones. So we're going to rotate our pelvis towards the bottom of our mat. So we're inhaling, feel the pelvic floor balloon. As you exhale, push your lower back into the floor and scoop your pelvic floor back into the pelvis. Inhale, lift your lower back, tilt the pelvis, balloon the pelvic floor. Exhale, lower back into the mat and bring the pelvic floor back in. Two more times. Inhale, tilt the pelvis, soften the pelvic floor. And then exhale, lower back down, kind of strengthen that area. So pull that area up and in. One more. Inhale, tilt and soften. Exhale, lower back down and kind of pull it back in. All right, so that's one exercise you can do to really start to feel what that area is supposed to feel like and really just create that rhythm that the diaphragm and pelvic floor should have. Now, the second thing, if you have a foam roller, the foam roller will work. If you have a yoga block, that'll work as well. Otherwise, you can roll up a few blankets to find something that is kind of has a pretty decent diameter. Because what we're going to do here, I'll just use the foam roller very easily. Again, this will be a myofascial treatment. Is we'll just come on we're just going to straddle the prop that you're using. So knees on either side. Um, you don't want to come too far back and kind of roll onto the back side of your pelvis. You want to kind of stay on the front side of the pelvis where the pelvic floor is. It's going to be sensitive because, like I said, nobody talks about this. Nobody says this is an area you can treat. So it might be a little intense to start with. So you can use your hands to kind of allow yourself to create the intensity that you want to have, but then just settle into it. And you don't have to do any motion, just make sure you're far enough tilted forward so that you're kind of feeling that slight intensity. And again, for myofascial to be beneficial, just hang out for about 5 minutes. Okay, pretend 5 minutes have gone by. You can remove the prop, whether it was the foam roller or blocks or rolled up thick towels. And that's a great way to just help keep your pelvic floor healthy and strong, yet pliable. All right. As always, if you have any questions, comments, or concerns, please reach out. I'm always happy to respond to any of you. And I will see you next time. Bye.